makes for the May 1st transition, we are confident that every county will be able to move to 100% capacity by June 1st. That is Nevada's goal, and that is the state level. We will do whatever we can to help counties get there, which leads to another update I'd like to give today. Originally, the state planned on keeping some mandatory measures in place at the statewide level when the authority transitioned to the counties on May 1st. However, after extensive conversations with state health officials and with the goal to reopen to 100% capacity across Nevada by June 1st, we will remove the statewide required social distancing mandate as of May 1st. This is one of the best measures I can take as your governor to increase flexibility and remove roadblocks for local authorities as they take over authority of mitigation measures. This is also a critical step to help ensure that by June 1st, full capacity means full capacity. To be clear, this does not mean that social distancing will no longer exist in the state. In fact, every health official will agree it's still an important prevention tool. This just means that the state will no longer be setting the requirements. That authority will also now transition to the counties, so they can make decisions based on what works best for their local jurisdictions. And when it comes to our biggest industry, the Nevada Gaming Control Board will continue to maintain authority over gaming areas, including gaming floors for licensed establishments within the state of Nevada. Additionally, all applicable establishments must continue to follow all requirements outlined in Senate Bill 4 from the 32nd special session and subsequent regulations. I know that the Gaming Control Board wants to return to normal just as much as everyone else does, which is why they've worked so hard with casino owners, local leaders, and employee unions to set up vaccination sites on gaming properties. Again, our state public health officials feel confident in this planned timeline to fully reopen by June 1st. But they made it abundantly clear that Nevadans must continue to get vaccinated and must continue to wear masks. That's why the state mandate will remain in place throughout this transition, the mask mandate, that is. Outside of getting vaccinated, it's still the best tool we have to prevent the spread. And I want to be clear, crystal clear. The mask mandate is a statewide standard. Counties have no ability to pass resolutions or create plans that attempt to override this mandate. This measure will remain in place to protect the health and safety of Nevadans to help get the state to a full reopening. I wish I could give all Nevadans an exact timeline as to when we can tuck away our masks, but public health officials made it clear that in order to reach our goal of reopening on June 1st, we must make sure Nevadans stay masked. It would be irresponsible for me as your governor to ignore that advice. Additionally, it's a common sense bargain. If we all continue to wear masks, it will help ensure that we can reopen our state by June 1st. In addition to lifting the statewide directive on social distancing requirements on May 1st and transitioning that authority to counties, I have another update I'd like to provide. Mitigation measures within our education system have always been separate from the general public measures, but in an effort to continue our transitions to local authority back to normal operations, as of May 1st, decisions over mitigation measures within our schools will also now be transitioned to county school districts and charter school sponsors. That includes social distancing. State Superintendent Joan Ebert and Nevada Department of Education have worked tirelessly with county school districts and the State Public Charter School Authority to get our kids back to the classroom and build an infrastructure to respond and keep everyone as safe as possible. That included providing PPE, setting up testing, contact tracing, and being one of the first states to prioritize educators for vaccinations. And as we know, school communities throughout the state vary greatly, and there are multiple factors to be considered as each superintendent or charter school sponsor and governing board consults with staff and families to determine what's safest and to best ensure healthy learning and working environments. As of May 1st, districts and charter sponsors will have full authority to make those decisions. Again, that doesn't mean mitigation measures such as social distancing will go away. It means each district or charter school sponsor has the opportunity to review and make the best decisions for their schools. As with every decision I've had to make throughout this pandemic, I know many people will say this is too soon. Others will say it's not soon enough. But today's announcement did not come without considering a myriad of factors, some of which I want to walk through now. For more than a year as a state, we have been vigilant, thoughtful, and deliberative in our decision-making process, always listening to science and doing everything we can to balance the health and safety of Nevadans with the economic impacts of this pandemic. And since our first case over a year ago, we've learned a lot. We've strengthened partnerships, built relationships, tested our public health system, and we are coming out of this stronger than ever before. We initially laid out goals for our response to prevent an overwhelming of our healthcare infrastructure and to prevent deaths from this virus. Our state mitigation measures have been rooted in these goals. Because of our efforts and the work of every Nevadan, we have seen significant improvements of key COVID metrics since January, all while our vaccination rates have increased. Over the last month, we have seen daily new cases stabilized at the lowest we have observed in nearly a year, with only slight increases since expanding capacity limits to 50%. These small increases are expected as we continue to open the economy and do not currently pose a threat to our hospital infrastructure. As we continue to vaccinate more Nevadans, we will continue to strengthen our defense against future surges and protect our vital public health infrastructure, a goal we've had all along. Healthcare providers have greatly improved treatments, and our incredible hospitals and healthcare workers have developed management efforts. These are noteworthy milestones that we can expect to play a significant role in ensuring that Nevada's hospital infrastructure never again reaches the strain that was experienced during the winter surge. I want to take a moment to thank Nevada's medical personnel. They faced immense stress, pressure, and unimaginable hardships for over a year. But even when tested, our healthcare workers and hospitals never broke. This test of our system shows how strong we are and that we can problem solve, and that across the state to support our residents. In addition to the progress made within our hospitals, we've also managed to build a stronger public health infrastructure to help manage going forward. State health officials, emergency managers, local health authorities, and partners statewide have made so much progress to build a testing and contact tracing structure to match the burden of the disease in communities. We now have capacity to conduct contact tracing and disease investigation at a much higher level than ever before. It's easy to forget how difficult it was to get a COVID test at the start of the pandemic. Since now COVID testing is readily accessible in communities throughout Nevada, I'm confident these response efforts that we built together over the last year will remain in place thanks to increased and extended federal funding. We have also prioritized and improved our processes and data, and now while cases are lower, counties are able to use this knowledge, respond quickly, and identify where interventions need to occur. This helps our efforts to slow the spread. We also know how important this is to protect our seniors and vulnerable populations from this virus, a key factor that was considered when discussing the June 1st goal. Nevada skilled nursing facilities, long-term care, and other residential centers moved quickly in our state's early response to improve precaution and work to protect Nevadans. In March, the COVID tracking project that follows COVID data nationwide reported that Nevada has the lowest percentage of COVID-19 deaths that occurred in long-term care facilities in the continental United States. This should make us all proud. I trust that our seniors and vulnerable Nevadans are in good hands, and the focus on protecting residents will remain going forward. In addition to all this progress, the introduction of COVID vaccines have changed the game. I have visited some of our COVID-19 vaccine sites across the state, and when you see people who are vaccinated and you hear the sigh of relief that they have, you know that people are feeling safer and more optimistic about the future. These incredible efforts on the ground and the focus early on in our vaccination plan to protect as many Nevadans as possible as efficiently as we could is showing signs of success. The vaccines have been shown to be effective against serious illness and death. And that is why we prioritize our vulnerable population to receive some of the first doses shipped to the state in December, including older Nevadans. We know that COVID-19 impacts our vulnerable population particularly hard. Sadly, 83% of COVID-19 deaths are among those aged 60 and older. In November and December, 61% of hospitalizations were among those aged 60 and above. But due to the hard work of so many, as of today, 65% of Nevadans aged 60 and older and 75% of Nevadans 70 and older have initiated or completed vaccination. And as more older Nevadans get vaccinated, the proportion of confirmed COVID-19 cases within these age groups has decreased. This and other updates I've provided are some of the reasons our state health officials feel comfortable with setting the goal at a full reopening to 100% capacity on June 1st. Vaccines are helping us protect those most at risk of hospitalization and death. And the progress continues. As of April 5th, Nevada is receiving an average of 74,000 COVID vaccine doses each week, which will allow for more appointments and more providers that have vaccines for their patients. Another reason we felt comfortable with the June 1st goal is because by that date, vaccination opportunities will have been open and available for all Nevadans 16 and older for nearly 2 full months. As more doses become available week by week, the Nevada State Immunization Program will continue to work with local leaders to focus on equity and increase accessibility by adding more convenient ways for people to be vaccinated, whether it is a drive-through or your local pharmacy. In Nevada, we are closer to the end than we are to the beginning. We are on our path to recovery, one shot in the arm at a time. So to recap, on May 1st, authority over mitigation members will transition to local control at the county level, and authority over mitigation members in schools will transition back to county school districts, including social distancing. Each county will be approving their plans in the near future. And today, I've set statewide goal that all counties be open to 100% capacity by June 1st. A safe and responsible reopening, like what I have laid out, is a path forward to bringing back our state economy, helping our small businesses, bringing back conventions, and getting Nevadans back to work. It's how we ensure Nevada doesn't spend the next decade crawling forward, but instead sprinting forward to create a better, healthier, and more prosperous state for all of us. In order to reach this goal, everyone must play their part. The state will keep the mask mandate in place and support all vaccination and response efforts. Counties must evaluate transmission in their areas and make best decisions on how to protect their residents starting May 1st. Businesses must continue to operate safely and protect our economic future. Finally, it comes down to every individual Nevadan. Every resident of this state, every resident has a stake in the game. Wear a mask. Stay home when you're sick. Get tested. And most importantly, get a vaccine as soon as possible. It doesn't stop with you. Call or text 5 people you know, family members, neighbors, friends. Share appointment information for vaccines. Help a neighbor schedule or give them a ride. If you're not sure where to start, go to nvcovidfighter.org for information or call the hotline at 800-401-0946. We know this virus is still present in our communities, And we must also accept the fact that COVID will continue to be present into the future, similar to other viruses that we're familiar with. But what we do know now that will allow us to return to more normal Nevada lifestyle on June 1st and focus on a strong economic recovery, remaining vigilant, wearing a mask, and most importantly, getting vaccinated as soon as possible. Nevada, we can do this. Let's meet the goal. Let's come back stronger together. Thank you all, and I will now take a few questions.
Hey there, Governor. Thank you so much for doing this today.
Thank you.
Brian with 2 News, just for the record. So we're starting to see other countries, unfortunately, go back into lockdown, and even some states, their governors coming out pleading with their citizens to take it easy and be safer. What do you think Nevadans have done to reach this point of 100% reopening? And at what point, since we are starting to see some other strains come in that are even more contagious, at what point could we get to where the state takes back control from the counties?
Well, I am confident in the residents of the state of Nevada. They've done an incredible job to this point in following our directives, the vast majority of the residents in the state of Nevada. The best 2 things that we can do to make sure that we don't take a step backward are get your vaccine as soon as you're eligible to get it, which is now for everybody 16 or older, as soon as you can get an appointment, and continue to wear a mask. Different communities are going to have different standards and whatnot for reopening because different counties are different, rural and urban, and the setting and whatnot. So I'm confident that if our residents follow these 2 simple guidelines, wear a mask and get your vaccine, we're going to be fine.
And is there any type of test positivity number, any rate increase or mortality increase that we see that the state has a mind on taking control back over from the
No,
counties?
I do not have a trigger figure for any of those things. I'm confident that if we maintain those 2 things and we keep getting every day that goes by, every hour that goes by that we get another shot in somebody's arm is making it better for us. And I'm confident that, residents will continue to do that. And by May 1st, June 1st, we're going to be in better shape.
Does the news of the Johnson & Johnson vaccine taking a step back on that, does that change any of these plans at all?
No, it doesn't change any of the plans at all. I mean, we're waiting to see how the review on the J&J vaccine goes. We had a White House call this morning with all the governors, and we went over this with a great deal of specificity. We're going to let the process through the CDC and the review go through what it needs to go through, and they'll make a decision, and we'll follow their advice accordingly.
Hi, Governor. Thanks for doing this. You called this a common sense bargain. Is this a response or attempt at compromise after rural counties like Nye announced plans to reopen to 100% without masks on May 1st?
No, I'm going to reiterate this one more time. They cannot open without masks.
I'm wondering if when you're calling it a bargain is an attempt to kind of meet that.
No, it's a bargain to, when you're dealing with, 3 million residents in the state of Nevada, who I want to reemphasize have done an incredible job getting us to this point. We are only here. We're in better shape than a lot of states are because our residents, vast majority of our residents, have gone along with the program and have tried to help. The bargain I'm making is a bargain with the citizens, the residents of the state of Nevada. If you continue to do what you've done, which is get your vaccines when possible, you get an appointment, and wear your mask, we're going to be in good shape, and we'll all move forward better and stronger. But we need to get people back to work, and that's what we're focused on doing.
So you know that county officials have at times criticized you throughout the pandemic for leaving them out of various planning processes. Why make this announcement in the middle of a 2-day task force about these very decisions? Since it looked like most were on track to do this anyways, is it a matter of who gets credit for reopening the state?
It's not a matter of who gets credit. I mean, we made a plan to give this authority over to the counties on May 1st. Some counties will do it, some will not do it. We've got 3 weeks left here. Businesses have asked for time to plan and to make accommodations. And in consultation with our medical experts, I'm not interested in who gets credit. We've been dealing with this for 13 months. I've been dealing with this. Now, you get a lot of people now suddenly, again, everybody's going to second guess or be a Monday morning quarterback. We have made the best decisions possible, and I'm excited to be in the position that we're at today. I really am. It's the first really good news that I've been able to deliver in a long time. And I'm hopeful that our residents take it that way and we can all be moved forward strong. Thank you.
Just a quick, simple yes or no question, and then I have a quick question about COVID. But we saw today a death penalty abolition bill come into the Assembly. If that bill lands on your desk, would you sign it?
Okay. I was expecting this question in light of what happened in the Assembly, and I'm going to read a prepared statement that I have. I'm not going to take any follow-up questions, but I'm going to leave it at the statement, okay?
And then can I ask a couple COVID questions afterwards?
You can have a COVID question after this, but no more death penalty questions. What I've said on the record in the past has not changed. Under most circumstances, I'm opposed to capital punishment. I know there have been wrongful convictions. I know there are significant costs associated with capital punishment and more. But as also said on the record in the past, there are incredibly severe situations that may warrant consideration of capital punishment. But I believe overall it should be sought and used less often. I was on the ground the night and the morning after 1 October. I was there. I talked to families whose loved ones were victims. The experiences of victims' family members are always on my mind. Just like the majority of Nevadans, as they consider this issue, that weighs heavily on me, which is why I have a hard time with the idea of a complete abolishment of the death penalty. I'll continue watching this bill. As governor, I have responsibility to be considerate of all these factors while I weigh any legislation that could get to my desk.
And then we've seen some small increases in case numbers and hospitalizations in recent days, and the state, as well as the rest of the world, is in a precarious position right now as the vaccines race against the variants. Why are you making this announcement today when we don't know what's going to happen in the coming weeks?
We never know what's going to happen in the coming weeks. If I waited a month to make this announcement, we wouldn't know what's coming in the coming weeks after that. I am so incredibly proud and appreciative of the work that Nevadans have done. Small businesses have sacrificed tremendously. Our labor force has sacrificed tremendously. Educators, frontline workers, students, parents, everybody has sacrificed. There has to be a light at the end of the tunnel. There has to be an opportunity for us to get back to our better normal. And I think this is the opportunity, and I'm confident with those two situations in place that people continue to wear a mask and they avail themselves of the opportunity to get a vaccine, we're going to be in a better position.
And then if we do see variant cases increasing, would that then necessitate the state stepping in again? Or?
I will continue as we move forward to listen to my medical advisory team. You know, they are not bringing it up at this time. I mean, anything could possibly happen. I talk to my friend Gretchen Whitmer pretty regular, and I know what she's gone through in the last couple of weeks. I cannot make a commitment on what's going to happen 2 weeks or 4 weeks or 8 weeks down the line, and I don't have a specific trigger number, whether it's hospitalizations or test positivities or whatever it might be. But you look back last year, November, December, we had 2,200, 2,300 cases in the hospital. I mean, we had a parking garage made into a hospital room here at Renown. I mean, in southern Nevada, they were using a convention center, different areas. We're down now to around 300 statewide hospitalizations because everything's improved. And every day that goes by that we vaccinate, as I said, we get 70,000 doses a week. You know, it's another 10,000, 11,000 doses a day are going into people's arms. Every day that goes by, it should be improving for us. Thank you.
Hey, Governor. Are you concerned about the pause on the Janssen vaccine creating more hesitation among people who are already on the fence about getting it, especially in the rurals? We have the FEMA truck now.
Yeah. You mean about getting the Johnson virus or vaccine? Yeah. Well, I got the Johnson vaccine myself, so I didn't have any hesitation about it. I'm confident the CDC is going to analyze this. I think they did the right thing. They started to see a pattern. They saw 6 cases out of 7 million doses that were given out. They're researching to see if there were more cases involved. They're going to have a thorough review of this, which is how vaccines are evaluated and how they move forward. I think they're making the right call, and we're going to follow their guidance. But I think it would be premature to speculate on what ifs. Let's see what happens tomorrow when they begin this review and how long it takes, and hopefully they'll get back to us.
Did you take this pause into account when making this decision today?
We took everything into account when making this decision today. I mean, I don't know if this pause is going to last a day, if it's going to last a week, if it's going to last a month. That'll remain for the medical experts to find. But I am confident with the position that we're in. The Johnson & Johnson, the J&J vaccines that we're getting are a relatively small percentage of our overall vaccines that we're getting. The Pfizer and Moderna vaccines have been absolutely incredible. They might cause some minor discomfort for people. They might get fatigued. They might get a sore arm. They might get some nausea, that sort of thing. But those are signs that the vaccine is working. And I'm confident that the more people get them, the better off we're going to be. And we'll be back to using all the vaccines that are available to us.
And then we've got an end date now for statewide social distancing mandates. You said that the mask mandate's going to stay. Is there a goal or an end date in your mind when that mask mandate might lift?
Yeah, as soon as I can get as many people in the state of Nevada vaccinated as possible, that's when we're going to be able to, but I don't know what that date's going to be if you're talking about a calendar date. It's important to me that we protect our residents, we protect our workers, our frontline workers, and we also open our economy back up. I mean, I need to get conventions, I need to get events coming back into town, into the state. I need to get people back to work as a result of those. And I think these openings are going to make that a lot more realistic and a lot more speedy. Appreciate it.
Thanks, everyone.
Okay, that's it? Thanks, y'all.